All right, so here we are in chapter 11, and this is modified diet plans. You will notice that this chapter kind of skips through a lot of different topics. So the first topic is talking about things that influence foods, how we choose food. So obviously you have availability of food, your budget, your transportation, if you have a garden, access to a farmer's market. And then what food products are available at what time in your geographical area. Then you have personal taste, what you like, what you're used to. You have the aesthetic influences. So when we talked before about a dysphagia diet, we can talk about visualizing what beef stew looks like versus blenderized beef stew. And we want to try and make those dysphagia foods as appealing visually as possible. And then we want to look at the color and how the plate looks. So we wouldn't have all beige foods or all cream foods. We'd want to make sure that we incorporate some color in there. So when we're planning menus for child care centers, home daycares, congregate meal sites, correctional facilities. Remember, we need to meet the nutritional needs, so we have the DRIs to fall back on to help with our nutrition planning. And then the child and adult care food programs that we'd see at a home daycare or a child care, if they're getting any sort of government assistance or government foods, then they have to follow the nutritional guidelines set through the USDA. So those facilities they may have different types of menus. So we have a fixed, a cycle, and a single use. You're all familiar with a fixed menu. That's what you see in a recipe, or excuse me, in a restaurant. They are offering the same type of foods every single day. A cycle menu is more commonly found in institutional settings, and a cycle menu is typically 5 or 6 weeks, and the same type of foods would be cycled through. And this is helpful for institutional settings like prisons, long-term care facilities, because you can do some planning and ordering to help with food budget. So, for instance, the residents would know that every 6th Tuesday is baked chicken dinner, and the cycle would be on that 6 week cycle at that facility. And then you have a single use menu, which would be, for instance, a Mother's Day brunch or an Easter meal. So it would just be used only once, and it's typically done in an institutional setting just to break up the monotony. So a selective menu is allowing the resident or the patient to have a little more choice. So you can still have a cycle menu, but it can be selective. So you have some different options available. So the residents or the patients might have 2 to 3 options to choose from on that cycle menu. So what we need to be sure of here then is that we're having those that have therapeutic diets or need therapeutic diets, we're having those available. So for instance, the baked chicken meal that I talked about last time, that's going to have to be available for heart healthy, for low sodium, for carb counting. So we'll just want to make sure that our staff is educated on those different types of diets. A non-selective menu, this is when the clients aren't making any choices. This might be a group home, an assisted living, and there is an option for a substitution if there's a food allergy or if the client, really hates that menu option. But they're very limited, again, to help with their budget and to help with planning. So I'm going to end this first video here because the next section we're going to move into life cycle meal planning.